बहुत शुक्रिया डॉक्टर मशकूर, आप PSM डिपार्टमेंट से हैं. Thanks for inviting me on the dice. Today's topic of presentation is liver abscess. It's very catchy topic and very dangerous. It is considered very dangerous because it's not found in a day-to-day condition or day-to-day practice. Liver abscess, of course, if you talk about the abscess, before going to the presenting liver abscess, we have to must be aware about the liver abscess liver blood supply, because liver abscess is produced because of the difficulty or the source in the abnormality in the blood supply. Whenever there is a some source of infection is there, that will come to the liver through the hepatic artery and of course from the GIT through the portal vein. You can see in the diagram, hepatic artery is a 600 ml per minute blood supply, which is 40% of the oxygen. And if you talk about the portal vein, 900 ml per minute blood, 50 to 60% of the oxygen supply of the liver. It is the largest organ of a human body, and it is very important in terms of the allopathy system of medicine, in terms of the Unani system of medicine, because our Unani physicians or Timpa also consider this liver very important, because our concept of akhlaq forms in none other than the liver, which is the site of formation of the liver, akhlaq arba, which is khun, balgam, safra, soda. So, if you talk about blood is the source of whenever there is a source of bacterial, viral, and other infection in the blood, that will come to the automatically to the liver. And if you talk about the anatomy of liver is broadly divided into the two lobes. Of course, right lobe and left lobe. Right lobe is the larger and left lobe is very smaller. Because of its larger size, it is more prone to get infected, because it has the more blood supply, and because infection depends on the source of infection is the blood, so more blood supply will go to the right lobe of the liver, and that will be the cause of source of infection of right lobe of liver involvement. This is another picture, and you can see here the abscess, which is necrotic cells, and it is the liver, and the gallbladder is beneath the liver. Liver abscess. Liver abscess occurs when bacteria, protozoa destroy hepatic tissue. Hepatic tissue produces a cavity which fills up with the infective organism. Whenever hepatic tissue is destroyed, there produces a cavity which fills up with the infective organism or liquefied cells and leukocytes. Necrotic tissue then falls off the cavity from the rest of the liver. This slide only want to say that when there is an area of pus or necrosis, all this area is cut off from the normal part of the liver. So this particular abscess region, if you look at the abscess region, it is liquefied, necrofied. So it is, so you can say necrotic tissue then falls off the cavity from the rest of the liver. Its connection disconnects. It disconnects from the rest part of the liver. Of course, right, we are talking about right lobe of the liver. If you see the another definition of the liver abscess, it can be also defined in another way. A liver abscess is defined as a pus-filled mass. Actually, when I will talk to in the later slides of the PPT. When we diagnose, we have to go for the USG. There are very pus-filled cavities. So a liver abscess is defined as a pus-filled mass in the liver that can develop from the injury to the liver. That mass will be developed from the injury to the liver or from an intra-abdominal infection disseminated, means spread from the portal vein. The majority of these abscesses are categorized as the pyogenic or the amoebic, although majority are caused by the parasites and the fungi. If we talk about the types, pyogenic abscess. Its incidence is, if you talk about incidence, male preponderance is more important, more common, because actually male are more addicted to the alcohol, toddy, and they are more outside. They remain more outside as compared to the second gender of the sex. And if we talk about the average age, it's between 43 and 60 years. If you look at the, if you focus on this age, it is basically age group when the, our immune system or our, defense mechanic of the body lowers, and after 40, as we all know that system weakens, and it is not, blood, blood is respiratory, digestive system is not different from the other system, so it is also weakens. Its immunity also weakens as age advances. Infective organisms invade the liver directly after liver round or spread from the lungs, skin, or other organs by hepatic artery, portal vein, and the biliary duct. These are the source from where the infection can get entry into the liver. Organism and causes. Biliary tract, underlying biliary disease is the most common cause. Septic cholangitis, biliary stenting, sclerosing cholangitis, cholangiocarcinoma. Portal vein, very important. Portal vein, portal pyemia following thalamic or the GI infection that leads to the portal pyelocolitis or septic. Pyelocolitis is nothing but the inflammation of the portal vein. Appendicitis is another cause, and the diverticulitis, perforated ulcer, pancreatitis. Hepatic artery. Hepatic artery is very important because, as I mentioned earlier, it supplies the blood to the liver. Bacterial endocarditis. It's a rare, but maybe bacterial endocarditis also may be the cause, and trauma. More important because when we see the RTA, road traffic accident, there may be chances of the trauma and penetrating wound in the case when someone is willfully give wound or attack someone. It's penetrating wound. And blunt trauma from some object which is blunt in the shape. Direct. That was indirect, and this is about direct source of infection, direct trauma, or source of infection, perforated peptic ulcer. Peptic ulcer is very important, and it's needed to say that peptic ulcer, there is a gastric ulcer and duodenal ulcers. Both comes under the peptic ulcer, and if we talk about this gastric ulcer, it is more common in the O blood group. So let's talk. Let's come back to the topic of perforated peptic ulcer and the subphrenic abscess. So the phrenic means below the lungs. Adjacent abscess, phrenic abscess. Adjacent abscess means phrenic abscess, maybe phrenic abscess. Miscellaneous, there may be miscellaneous causes, obscure in 5% cases. After thorough investigation and the history, we still cannot get the real cause. What is the cause of the liver abscess? So it is found in the 5% cases. It is obscure, not clear whether it is from trauma, whether it is from source from the GIT and other